On this week's episode of Fish Tank, a pharmacist is seeking a 3-year, $500,000 grant to develop a new pharmacy-driven clinical service line.
Welcome to Fish Tank. Introduce yourself and explain why one of us 3 fish should financially back you for a 3-year, $500,000 finance for your pharmacy service.
Alright, how's it going? My name's Nahula, and I'm just a pharmacist from a small town area called Dunklin County, Missouri. Just to let you know, I'm really glad that I could be here to discuss to you my service proposal for Dunklin County, Missouri. I just want you all to know that I'm really glad. I feel like it's a big opportunity for me. I feel like I'm able to help a place that really do need help, and by the end of this, I actually would want to be swimming with the fishes.
We're happy to have you here with us as well. So level with us. Why should Dunklin County receive this grant for a new healthcare service?
Well, like I said, Dunklin County is a small town community. And trust me, I love it to death, but it's for that reason that it's so small that it's also severely medically undeserved, which actually provides opportunity for pharmacists just like me. Now, if you don't know, now you know, pharmacists are one of the most accessible and trusted healthcare professionals. While we have an extensive knowledge on disease states and the disease state medications. Alright, so because Dunklin County is so undeserved, it's currently one of the most unhealthy counties in the state of Missouri. Specifically, it ranks 106th in the state based on health outcomes.
So it looks like there is a need for some medical services in Dunklin County. Could you go a little more in detail of what you would provide, what kind of services?
Alright, of course, I can tell you what we service. Let me just tell you something, Andy. Is it alright if I call you Andy? Alright, well, our clinic is open to walk-ins as well as scheduled appointments. We also provide medication reconciliation, also medication monitoring, and health condition maintenance services, such as for people who have diabetes.
Okay, those services you just talked about seem like they're really needed in Dunklin County. But first off, how are you going to be able to attract the patients into your clinic? How are you going to bill for these services? And how is this going to be financially stable from that 3 years? How are we going to be able to invest in you and end up actually making money?
Alright, so I know this ain't no popularity contest, but to get ourselves out there, we've been using flyers to send out to let the county know about our services, and that we have also been collaborating with various physicians. Alright, the reason we do this is because we want the physicians to also trust us to send us patients. Many of our patients, through feedback, have told us that they've been very satisfied with our services. And this could also just be due to the affordable prices and the trust that we build with these patients after our services. They truly feel like we're one of them. Alright, so I'm about to throw some stats at you. Alright, so it seems about a little bit over 17% of Dunklin County is over the age of 62, which is actually higher than the national average, which is at 14.9%. This means that more likely the population has a higher chance for disease states, and they're also eligible for Medicaid. Like I said, 37% of Dunklin County are covered under Medicaid. The way this ties in is that since our services are covered under Medicaid, this makes our product affordable to the patient, which also makes it easy for us to bill our MTM services through Medicaid with the help of cyber access. Alright, so hopefully y'all are able to see the figures that I just displayed for you all. And basically it just kind of states that through our fee-for-service model, with a copay of only $25 per visit, we'll be able to actually break even and make a sustainable profit with just 2,700 patients per year, or 2,700 visits per year. These services ranges from A1C monitoring to lipid panel management and even blood pressure control.
And now it's time to see what the fish think.
Well, Mr. Nahlo, after having a moment to consult with my other fish here, we have decided after viewing your presentation and these figures that your annual goal of 2,700 visits to reach a profit is sustainable, and we would like to offer you this 3-year, $500,000 grant for your service.
Welcome to the team. It's time to swim with the fish.
Woo, thank you very much. You won't regret this. Thank you. Thank you
Very
so much.
excited.
Damn, I'm very excited myself.
You're gonna do well.
Yeah, Dunklin County's going to be a whole lot better after this. I swear we're going to be doing business for a long time.
All right.
Happy to hear it.
It's got good to have
I like this guy. It's got me excited for our future.
Yeah.